everyone, it's Nurse Nay with Nursing with Bonomi, where we put the page into practice. Today we're going to talk about something not so fun. We're going to talk about death and what to do when one of your patients dies and the type of progress note you need to fill out. Before we get into the progress note, I do want to talk a little bit about the legality of pronouncing someone's death. So it really depends on what state you live in. It seems, however, that several states allow registered nurses to pronounce death if they are residing in a nursing home or a home care or hospice situation. But please check your local Nurse Practice Act to see what exactly is within your scope of practice. I did find some interesting information on the American Family Physician Journal's website. It gives the steps as to how to pronounce someone's death. So first you would check their ID, their bracelet if they have one. Check their pupils to see if there's any change. They should be fixed and dilated. There will be no reaction to verbal or tactile stimulation, no spontaneous respirations or breath sounds can be heard, no heartbeat can be auscultated, and also no carotid pulses are palpable. So at that time you can then write down the time of death. Now this is a really nice point I never thought of, and I really wish I had, is to explain to the family what is going to happen when you see that the patient has died and you have to assess what we just did right there, what we just talked about. It would be really nice to ask the family if they want to stay in for the examination or not. I never thought of doing that, and I always felt extremely awkward trying to listen for a heartbeat for 60 seconds while the family is standing there sobbing. So asking them to step aside for a moment or whatnot, that would be very appropriate. Now let's get into the progress note. Here's an example of what you could write. Patient expired with hospice nurse at bedside on this date. Patient noted to have absence of apical pulse for 60 seconds. Time of death 1800. Doctor so-and-so notified at 1805. Family notified at 1810. Permission to release body to funeral home of family choice received. Such and such funeral home contacted. So that's really all you need to do to pronounce someone as deceased, and then you, however, have nothing to do with the death certificate. That is only the physician or the funeral home director. So basically you really need to know what your scope of practice is and what your state Nurse Practice Act says regarding pronouncement of death. Thank you for watching, and please subscribe and hit that notification bell so you know when our videos come out. Take care and have a great day.